Assalamu alaikum, dear viewers. I am Professor Dr. SMA Erfan, a colorectal surgeon. Today, I am here to speak with you about the symptoms of a specific anorectal disease, the anal fissure. As many of you know, I have been providing treatment in colorectal surgery for a long time, and now, with laser proctology, the treatment that uses lasers, I am one of the surgeons who performs the highest number of these operations worldwide, and my cure rate, or the rate of recovery, is among the highest in the world. Laser surgery is a highly technical procedure. In many cases, patients don't get better. Patients often say this. But in my case, almost everyone, about 99.9% of patients, are getting better. If you have any questions regarding colorectal issues, you can ask us. We will try to answer your questions. We are now at our new chamber, Dr. Erfan Colorectal Center in Panthapath. We are providing treatment here. This is a modern chamber with all the necessary facilities. You are all welcome to this chamber. Today, we will talk about anal fissure, a disease of the anal canal. In the local language, it is commonly called gas. What are its symptoms? Generally, there can be two types of anal fissure in our terms. One is an acute anal fissure, and the other is a chronic anal fissure. An acute anal fissure happens first. It occurs suddenly. Perhaps the patient is normal, but at some point, their stool suddenly becomes hard. When they strain to pass the hard stool, the anal canal tears. Then they experience severe pain, a burning sensation, and a little bleeding. This is what we call an acute anal fissure. An acute anal fissure can happen even if the stool is not very hard, especially if the anal canal was already narrow. The patient might not realize their anal canal is narrow. They may have normal bowel movements, but the stool is a bit thin. However, when the stool becomes even slightly hard and they apply pressure, it tears. Then this problem starts. And a chronic anal fissure is what happens after an acute fissure occurs. The patient naturally tries to soften the stool, either by taking some medicine on their own or by visiting a doctor. A surgeon might give them some ointments and medications to take and apply. After using these, the anal fissure heals. However, after it heals, in many cases, the anal canal becomes narrow. Then their toilet problem becomes permanent. This means they have to strain to pass stool, they feel a burning sensation in the anal canal, and experience a little pain. They often suffer from constipation, and the stool doesn't clear easily. They might feel a swelling in the anal canal where the tear was. These symptoms are indicative of a chronic anal fissure, and it's a long-term problem with minor issues that can eventually become more severe. This is the chronic anal fissure. When this chronic anal fissure persists for a long time, it may cause a little bleeding, some pain, and a burning sensation. Then you might notice that your stomach doesn't feel clear. You feel bloated, and constipation increases. Sometimes the stool becomes loose and thin, requiring frequent trips to the toilet. The stomach doesn't feel clear, leading to discomfort, gas, and so on. So, when an acute or chronic anal fissure is not treated, it gradually leads to complications. In many cases, it turns into another disease that we call ODS, or obstructed defecation syndrome. This is a complex condition. Therefore, those who have this kind of problem should seek proper treatment, the kind of treatment that will fully cure them. And the best option for this is to consult a colorectal surgeon. By subscribing to and following our Facebook and YouTube channels, you can get new information about various anorectal diseases. Thank you all very much.